Well, I'm a member of the patient advisory group. So with that, I've been doing various projects. I've been creating a patient passport. So it's a file to help patients track their condition and all of their treatment. And I've given a small talk on that and also helped with the roundtable discussions about chronic pancreatitis.
Tell us a little bit about the patient passport and why it's so important.
Well, it's a way of patients to kind of take control of their condition and track what's happening and understand what's happening. So I've done quite a lot of work in support groups and also a survey about patient experience. And one of the things I found is that communication between the patient and their various consultants and other medical professionals can be really quite poor. So not being given discharge summaries from hospitals or sent GP letters or reports from scans or blood tests or whatever. So it can end up with the patient not really understanding what the treatment is and what's happening to them. So it's to assert patients that they can get these documents, and it will just make life a lot easier if they have to go and attend an A&E where perhaps they don't have their full notes, or if they change consultant, or even if they end up in a position where they need to retire early from work or apply for benefits. All of this information is really valuable evidence. So we get stories from support groups and so on, where you get people who are going for treatment that they don't even know what it is, or don't understand really what their diagnosis is. So it's to help people take control and understand these things and then be able to use the information to their advantage. So for example, I am now treated at I think 4 different hospitals, and no one hospital will have my full notes. So it's really important that I go along to consultant appointments with the new consultants with all of that information so they can look at it, because there's no other way they'd have it. So I mean, they would need to repeat all the tests and things that I've already had if I don't physically go there and give it to them myself. So if you want to get involved, unfortunately we don't have quite as many copies as I'd hoped, but if you could leave them where they are downstairs. This is my 3rd year that I've come here, and I originally found out about it because I was involved with setting up a support group called the Pancreatic Tree on Facebook, and we heard about it, and I've really wanted to get involved with improving things for patients, because it took 6 years for me to get a diagnosis, and I had just assumed that I was unlucky. But when I've also done a big survey of the treatment of pancreatitis patients and had 145 patients fill it out. And on that, when I did this, it's really sad, but it's really common to have a slow diagnosis. There's a lot of people who have over a year for a diagnosis, and there are 3 patients who had over 20 years to get a diagnosis. And that 3 out of 145 is 3 too many, really.
What's the biggest drawback of people having to live with the disease on any level?
Pain, constant pain. That's the biggest problem. And it means a lot of people end up unable to work, which is really frustrating. I'm in that position, which is the reason why I like doing these things, because it's good to have something that I can be proactive about that uses my brain.
Are you feeling physically okay yourself in that respect?
I'm somebody who's always in pain, but the way to live your life is to get on and do as much as you can, and that's what I try to do.
Brilliant. Well, good luck, and thank you for giving us opportunity to talk about
You're welcome.
disease and pancreatic cancer.
Thank you.